Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's have a quick anatomy lesson. Today we're talking about feet. Did you know that your feet have 26 bones in them? Those 26 bones join together and make 33 different joints in each foot specifically. That's so astounding, right? There's over 100 muscles, ligaments, and tendons in the foot just to get us to walk. It's a pretty big deal. Now, we oftentimes forget that we have all this going on our feet. We live in a world where we wear shoes all day long. Our feet are cooped up. It's kind of like they're in foot jail. They're not moving and functioning like we're supposed to. We're supposed to be able to move and mold to the earth. And yes, the shoes are great and they protect us and they help us do a lot of really cool things. But we also need to make sure that we're not 100% reliant upon them, that our feet can be feet. So this quick anatomy lesson is going to help give us a better understanding of what's going on with our feet, and then how that can lead to some of the other issues that we see that are super common in today's world. Now, when we look at those 33 different bones that we talked about, 26 bones, 33 joints, there's a couple of different ones that we really want to look at. So this is from the top down view, and this is from the side. This purple one in both of these, that's known as our calcaneus. That's our heel bone. On top of that is going to be our talus. The talus is what starts to make up the ankle joint within the foot. We see the blue one here is going to be our navicular, where this teal looking one is our cuboid, and lastly cuneiforms. We don't worry so much about the toes in this conversation, but those muscles start to move and function. We can see that we have that natural arch there from the outside and from the inside. All of these coming together to make this. So this is just the deepest layer. We take a step back and we look at our plantar fascia. This is one you've probably heard of. Now that plantar fascia is a piece of fascia. Plantar means bottom of the foot. Now fascia is just fibrinous tissue that pulls together to make a band. It in and of itself doesn't have a muscle within it. It's just like a ligament that just holds these things together. And so this is going to start on our heel or on our calcaneus and pull through across the bottom of the foot. If you were to feel the bottom of your foot and push in just a little bit so you feel deeper than the skin and feel that dense tissue, that's what this is. That's that plantar fascia. Now we know about this because plantar fasciitis, inflammation of the plantar fascia, is extremely common, stemming around here through the heel. We'll talk more about that in other videos. But this plantar fascia specifically starts actually up higher. We can look at our calf muscles here. This is our gastrocnemius and our soleus. Those two muscles make up the back of our calf or the back of our leg. And they turn into your Achilles tendon. Tendon that's really strong and responsible for transmitting all the force from that lower extremity down into our foot. And so that comes down and across, and that Achilles tendon wraps around the back of the heel and is the same piece of fascia that turns into your plantar fasciitis. So that's just a continuation of the fascia from up the limb. So that's why when we look at patients with plantar fasciitis and start to treat, we're gonna not just work on the bottom of the foot, we're gonna look at the Achilles and the muscles above it as well. Because if the kinetic chain is affected above it, it's going to trickle down and create issues down lower as well. So hopefully this gives you a better understanding of what's going on our feet. They're super cool joints. There's super cool things going on there. If we don't take care of them, every step's going to be harder than it needs to be, literally and figuratively. Now, if you want to know more about the foot or what may be going on with your foot specifically, come on in. Let's chat about it.